Hi, my name's Christina. I'm the nurse practitioner
Hi,
today.
Desmond.
Is that what you like to be called?
Yes, that's fine.
Okay, how are you doing today, Desmond?
Doing pretty well.
Alright, so what brings you in?
I'm just here for a normal physician checkup.
Okay, so an annual checkup?
Yes.
Do you have a current primary care physician?
I did, but he retired, so I'm looking to establish a new physician.
Okay, alright, so I'm just going to give you a little rundown of our normal process with new patients. I like to sit down and kind of talk to them about their background, their medical history, all that good stuff. It usually takes about 15 minutes or so. So let me know if any time you want me to slow down, pause, or if you need me to clarify anything.
Okay.
All right,
Sounds
sound
good.
good? All right, so we'll get right into it. So how old are you, Desmond?
I'm 24.
24? Okay, and what is your ethnical background?
I am African American.
African American, okay. Do you have any current medical conditions?
No.
No medical conditions, okay. Have you had any recent illness, recent sickness?
I had the flu a couple months ago, but other than that, I'm pretty good.
Okay, and that was your most recent doctor visit then?
Yeah.
Okay, all right. And what type of flu was it? If you remember?
Influenza type A, I believe.
Influenza type A, okay. How are you feeling after that? Pretty good?
Yeah, pretty good.
Okay, good. Do you have any current allergies?
No.
Okay. Are you on any medications?
I do take melatonin a couple times a night to help myself sleep, and ibuprofen whenever I get a headache.
Okay. Do you know what the dosage on that melatonin is?
I believe 10 milligrams.
Okay, and you said every couple nights you take that?
Yeah.
Okay, and then the ibuprofen is pretty much as needed for headaches, is that correct?
Yeah.
Okay. A little bit about these headaches. How often do you get headaches?
Occasionally a few times a week, maybe after work. I stare at screens pretty often as I do accounting work, so I'm always looking at computer screens.
Okay, all right. Where do these headaches tend to be located?
More in the front of the head, I believe.
Front of the head, okay. How long do they typically go on for?
Until I take some medicine, they'll usually go away after 30 to 45 minutes.
Okay. And how would you describe these headaches? Like achy, dull, sharp?
Yeah, I'd say they're kind of achy.
Kind of achy, okay.
Yeah.
And it sounds like you kind of attribute this to long work days and
Yeah.
maybe some dehydration. Stuff
Yeah,
like
probably
that.
some hunger as well. I tend to not eat until after work, so.
Okay. And the ibuprofen tends to help?
Yeah.
Is that correct? Okay, good. All right. In terms of vaccines, as far as you're concerned, are you pretty much up to date on all your
Yeah,
vaccines?
for the most part. I recently got the COVID vaccines, the first dose and the second dose.
Okay.
So.
All right, so you got both COVIDs. Do you remember which one that was?
Pfizer.
Pfizer, okay.
Yeah.
Did you happen to get a flu vaccine this season?
I didn't.
Okay. All right. And you said no medical conditions that you're aware of, correct?
No.
Okay. Have you had any surgeries throughout your life?
I did have surgery for a sinus surgery when I was in 7th grade.
Okay. Sinus surgery, 7th grade. All right. Any other surgeries such as like wisdom teeth removal, anything like that?
No.
Okay. All right. So now we are going to go into a little bit of your family history. I kind of like to see different conditions that your family may have to see if there's a possibility that you could develop these as you get older. So if you don't mind, we'll start with your mom's side and then we'll move on to your dad's side, kind of organize it. So is your mom currently living, and if so, how old is she?
Yeah, she's 55.
Okay. And does your mom have any health conditions that you're aware of?
She had breast cancer in 2008. It is currently in remission. So other than that, I think she's doing pretty well.
Okay. Any other conditions you can think of?
Nope, not at the top of my head.
All right. And what about your mom's mom, so your grandma?
She does have type 2 diabetes.
Okay.
And also has COPD.
Type 2 and COPD, okay. And do you know anything about your grandpa on that side?
No, unfortunately.
Okay. All right, so we'll move on to your dad's side. How old is your dad?
My dad is 56.
Okay. Does he have any conditions that you know of?
He does not.
Okay. And what about your grandma and grandpa on that side?
They both have high blood pressure.
Okay.
And my grandma recently had a heart attack a few months ago.
Okay. All right, so it sounds like some cardiovascular disease on your dad's side then. All right. Do you have any siblings?
No.
Okay. Any other family medical history that you can think of?
No, not at the top of my head.
Okay. All right, so now we're going to kind of move into a little bit about yourself, your social background, kind of what you do on a day-to-day basis. So where do you live?
I live in Delaware.
Okay. Do you live with anyone?
Yeah, I live with my girlfriend and her family.
Okay. And do you work? Are you in school?
Yeah, I go to school full-time at Ohio State, and I also work part-time as well in Westerville.
Okay. And what are you going to school for?
Accounting.
Accounting. Okay. So that'll be your bachelor's then?
Yes.
And when will you graduate?
I'm graduating this May.
Okay. And then your part-time job, about how many hours a week do you say?
About 10 to 15 hours.
10 to 15 hours, okay. All right. Sounds like you have a pretty busy life with school and your job. Do you feel like you have an adequate support system?
Yeah, I think I do.
Okay.
I take things day by day, but my support system really pushes me through the way.
Okay, good. Do you have any religious background?
I am Christian, but I don't regularly attend service.
Okay. Let's see here. Do you use any tobacco products?
No.
Cigarettes? Anything like that? Okay.
No.
Any use of drugs, legal or illegal?
No.
What about alcohol use?
Occasionally, maybe once a month.
Once a month? Okay. All right, good. In terms of your exercise, how many times a week would you say you exercise?
Maybe only a few times with walking on campus, to and from my car in the parking lots. That's really about it.
All right, so sounds more like kind of cardio exercise.
Yeah.
Okay. Obviously, we do recommend like 30 minutes a day. So we'd like to see that get up. I know you're pretty busy. But yeah. Let's see here. What is your diet look like?
Right now it's pretty poor, I'd say. I eat a lot of processed foods, so I wish to, get better in that aspect of my life after graduation.
Okay, all right, good. In terms of your sexual activity, are you sexually active currently?
Yeah.
Okay, any history of STDs, STIs?
No.
Okay. All right, anything else you can think of in terms of your social background, anything like that?
Not that I know of.
Okay. All right, so now I'm going to kind of move into a little like head to toe type assessment. I'm just going to ask you about each body system, kind of go into detail a little further on those, okay?
Okay.
So generally speaking, have you noticed any like increased weakness, tiredness, fevers?
Nope, I don't think so.
All right, good. In terms of your head region, do you wear glasses?
I do have glasses, yeah, and contacts as well.
Glasses and contacts, okay. Do you see an ophthalmologist regularly?
Yeah, about once a year.
Once a year, okay, good. Do you remember the last time you saw them?
Yeah, in August of last year.
Okay. Do you have any eye pain, ear pain, nose pain?
Nope.
Okay. And then the headaches we did discuss already. Those sound like they're a couple times a week, you mentioned?
Yeah.
Okay. Are you experiencing any swelling in the neck, nose, eyes, any facial region?
No.
Okay. Are you noticing any discharge from your ears, eyes, or nose?
No.
Okay, good. All right, now we're going to move on to your pulmonary system, kind of your lung region. Do you have any pulmonary conditions that you're aware of?
No, not that I know of.
Okay. I know you mentioned your grandma has COPD, but other than that, do you know anyone else in the family who has COPD?
Nope.
Okay. Have you noticed any cough, anything like that?
Nope.
Okay. Any shortness of breath?
Maybe only when I do work out, maybe a little bit, but that might be due to being out of shape, maybe.
Okay. So no history of asthma?
No.
Okay. All right. And you mentioned you do not smoke, so that is great. Any other pulmonary things you can think of?
Not that I know.
Okay. We'll move on to the cardiac system. So your heart, do you experience any chest pain?
No.
Any palpitations? Okay. Have you noticed any swelling in your feet, legs, hands, anywhere?
No.
Okay. In terms of like your heart rate, do you monitor that at all?
I do use my Apple Watch, so it'll alert me when I do use it. I haven't noticed anything particular that should be happening, so I think it's around 70.
70? Okay.
Yeah.
All right. That's definitely normal, so that's good to hear. Any other heart things you can think of?
No.
Okay. So now we'll move on to your GI, so your abdominal region. Do you notice any nausea, vomiting?
No.
Okay. Any diarrhea, constipation?
No.
Okay, good. How's your appetite?
Appetite's pretty good.
Okay.
So.
All right. You eat roughly 3 meals a day?
Yeah.
No nausea afterwards or
Nope.
anything like that?
All good.
Okay. Any heartburn after you eat?
No.
Okay, good. Any abdominal pain anywhere at all?
Nope.
All right. Have you ever had any history of appendicitis, gallstones?
I haven't, but my mom had her gallbladder removed a few years ago.
Okay. So your mom had a gallbladder removed. All right. So now we'll move into the urinary system. Do you have any pain with urination?
No.
Okay. What color is your urine typically?
Yellow.
Yellow. Okay, good. Is it clear that you notice?
Yeah, for the most part, yeah.
Okay. Any blood, anything like that in
No.
your urine? Okay. Do you have a history of any UTIs?
I had one 4 to 5 years ago, I believe.
5 years ago? Okay. Any kidney stones?
No.
All right. Any other urinary issues you can think of?
Nope.
All right. In terms of your skin, do you have any skin conditions?
I had eczema when I was a child. I think I've kind of outgrown it, but there is sometimes I do get dry areas, dry patches on my skin, and yeah.
Okay. Typically, where are these dry
I
patches at?
would have them on my arms as a child, and I don't really get them anymore, but sometimes I get them in, like on my eyelid or maybe
Okay.
my armpit, like where the crevices are.
What kind of treatment would you use for
We
these?
would use steroid cream.
Okay.
I'm not sure what the exact name of the
Sorry?
medicine was, but
And you said this really doesn't occur anymore. It was more when you're little.
not really. But I do get it small areas.
Okay. Have you noticed any moles or abnormal moles on your body?
Not right now, but I actually did get a mole removed last June by my old primary care provider.
Okay.
And it went to the lab and it came back as non-cancerous.
Okay. Good to hear. So obviously we want to keep an eye on any other moles in that same area. You said it was your back.
Yeah. Oh yeah, my back.
Okay. We want to make sure there's no regrowth or anything like that. Do you use sunscreen?
I do sometimes. Yeah.
Sometimes. Okay. Obviously we want to use sunscreen to prevent, any skin cancer or anything like that. Not only does it just prevent sunburn, but it does, it's a preventative for skin cancer.
Okay.
In terms of musculoskeletal, do you have any pain in your arms, legs, bones, muscles?
No.
Okay. Have you ever broken any bones?
I broke my middle finger in 7th grade.
7th grade, okay. Do you notice any issues with that finger still?
No.
Okay. Any weakness or numbness in any extremity?
No.
Okay, good. In terms of neurological, so kind of your head, have you ever had any neurological conditions?
No.
Okay. Have you ever had any head injury, concussions, anything like that?
I think I had a concussion, but it was non-diagnosed
Okay.
when I was a few years ago.
Okay. Any abnormal blurry vision besides what you experience on a day-to-day basis?
No.
Okay. Any numbness, tingling in your fingers, toes,
Nope.
anything like that? Okay. In terms of your blood, do you have any history of blood disorders that you can think of?
No.
Okay. Any like sickle cell anemia, clotting disorders?
Nope.
Okay. When you do get injured, do your bruises appear relatively normal?
I would say so, yeah.
Okay. And when you get like a cut, how is the bleeding? Is it pretty controlled?
Yeah, I don't bleed abnormally, and when it scabs over, it seems to be pretty normal. So.
Okay. Do you know what type of blood you are?
A positive.
A positive. Okay. Have you ever required a blood transfusion?
No.
Okay, good. Let's see here. Do you feel safe at home, free from abuse?
Yeah.
Anything like that? Okay. And you already mentioned your support systems or your family, your mom, your friends. Is that correct?
Yeah.
Okay. What do you most enjoy in life?
I just enjoy hanging out with the people I care about the most and living life to the fullest.
Okay. So on a day-to-day basis, do you feel relatively happy?
Yeah.
Any anxiety or depression?
I mean, things do get stressful, but I feel like, it's nothing I can't manage.
Okay. All right, good. Do you have any difficulty sleeping that interferes with your life at all?
No.
Okay. All right, good. And overall, how do you feel about your current health state?
I feel like there's room for improvement. After graduation, just changing my diet and how I physically treat my body. So I feel like there's room for improvement there.
Okay. Yeah, good to hear. There's definitely, we can all improve things in life. But it sounds like you already know which areas you'd like to improve, so that's really good to hear. So that pretty much finishes up my questions. Do you have any questions for me, Desmond?
I don't think so.
All right. Well, it's nice meeting you,
Yeah,
Desmond.
you as well. Thank you for your time.
Yeah, thank you.